the current levels of pollution that we're all breathing are unacceptable, and we can't tolerate it more because it's killing us.
We deserve clean air now. We deserved it yesterday. Our children deserve it.
This is a paper towel off a screen from my bedroom window that I clean every week. I clean this crap off my window.
The Clairton Coke Works is one of the most toxic industrial facilities in Allegheny County.
I never missed a day running in New York City because the air smelled or because I felt like I had a breathing issue. In Pittsburgh, I've missed too many days to count.
The most livable city in America isn't livable if the air isn't breathable.
So welcome to the fire. Because we've been putting up with U.S. Steel's poor environmental record for 150 years now. My mother, who passed away last year from COPD, she never smoked a cigarette in her life, but we live right here next to U.S. Steel.
Everybody in my family's been ridden with cancer. My brother just died of cancer.
Approximately 130,000 people live within a 5-mile radius of the Coke Works. People in this area have air that's worse than 91% of the entire country.
The children are being sickened. They're developing asthma at a very early age.
I am also the mother of 2, and I fear for my children's and my family's health.
I have a 5-month-old daughter who I'm scared to raise here in this city.
A year and a half ago, I was diagnosed with chronic bronchitis that is likely due to the poor air quality in Pittsburgh.
And I can't understand how there's not enough compassion to put a stop to this.
So welcome to the fire.
If you understand that your child's asthma is approximately the result of Norfolk Southern or is going to be exacerbated by it, then you're going to come to a meeting and raise your voice.
Where petrochemical development occurs, people tend to suffer.
This area has so much more to offer than becoming a cancer alley.
We've got our work cut out for us.
The county health department is in charge of enforcing our Clean Air Act and protecting our health. Do you think they're doing a good job? No!
This anger, anxiety, and frustration are the results of residents enduring decades worth of air pollution and violations.
It's on us to be bold, and it's also on us to listen to the needs of the people who are here. They are suffering.
Welcome to the fire. 'Cause the bigger they are, the harder they fall. You build your fortress and I'll climb your walls. You got your armor, but I see your flaws. So welcome to the fire.
We are starting to elect politicians who pay attention and fight hard for clean air. And if you do not fight hard for clean air, we're done with you.
We have to hold accountable those who are harming our communities.
So welcome to the fire.
For decades, we have not been able to breathe.
There is a legal and moral obligation to make the county act.
What do we want? Clean air!
Because cancer should not be the cost of breathing in America's most livable city.
Enough is enough.
Good evening, everybody. I'm Howard Rieger, convener of Southwestern Pennsylvania Grassroots Town Halls, and welcome to our 16th session, entitled, Why is the Health Department Funding in Limbo? In 2023, our Grassroots Town Halls sent a questionnaire to all candidates for Allegheny County Executive, asking, among other things, what is your plan to adequately fund the Allegheny County Health Department and assure that it carries out its environmental protection mandate aggressively. Sarah Inamorado, the ultimate victor, wrote the following. Currently, the health department receives 5% of Clean Air Fund revenue, which comes from fines paid by polluters for violations. This is a perverse incentive for the pay-to-pollute model. We can't continue to allow the health department to be funded via fines, as it starts a cycle allowing more pollution and therefore more fines to ensure that ACHD receives more funding. It has been a year since ACHD proposed a fee increase on polluters seeking operating permits, which for existing facilities must be renewed every 5 years. The annual cost for the maintenance permit for a major source of pollution would increase from $8,000 to $55,000, thus meeting more of the costs that such permitting requires without increasing taxes. U.S. Steel, our number one source of pollution, would have to pay $165,000 per year for its permit. For a company that earned $15.64 billion in revenue last year, that should, to put it mildly, be manageable. For smaller sources of pollution, the annual fee would increase from $2,000 to $4,250. The county's Health and Human Services Committee approved the proposal, which requires approval of the county council. So far, there have not been enough council votes for passage. While we await county council approval, people are dying or becoming seriously ill because of the pollution that affects all of us. Last February 21, we lost Catherine E. Thomas, the wife for 57 years of Clairton's tireless activist Arthur Thomas. 3 weeks later, Clairton resident Johnny Perryman died. Wheelchair-bound Perryman appeared at meetings and rallies addressing air pollution, where he spoke about his doctor's recommendation that he move out of Clairton. Sadly, he didn't have the strength to make the move that might have saved his life. We dedicate this town hall and all that we will continue to do in their memory, in the memories of the thousands of others who have died over the years, or who have had their quality of life impaired because of the failure of industry to maintain and upgrade the systems that could better protect all of us. If this were just a health emergency, that would be bad enough. But it also reflects a lack of vision on the part of regional leadership that is squandering the outstanding assets that we possess in virtually every sector, and which, if properly deployed, could chart a healthier and more promising economic future. In a July 12 article, the Wall Street Journal reported that our local officials formed an artificial intelligence strike team to try to position Pittsburgh as a global AI hub. One of the sites that they picked for a data center, which will require huge amounts of power, is a former massive J&L steel mill along the Ohio River in Aliquippa, which once employed more than 13,000 workers. Data centers, according to the journal, cost from hundreds of millions to billions of dollars to build, but rarely need more than 100 to 200 workers to operate. Sound familiar? It should, because the Shell plastic plant in Beaver County cost $6.5 billion to build, including a $1.7 billion subsidy from the Commonwealth of Pennsylvania. It barely employs 600 full-time workers and has become a major source of pollution. At the Energy Summit held earlier today at CMU and attended by President Trump, Governor Shapiro, Senators Dave McCormick, John Fetterman, and many corporate leaders, there was an announcement of up to $90 billion of investments in AI and energy projects in Pennsylvania, many right here in southwestern PA. It seems likely that this will be yet another way for companies and their investors to profit, while the workers are left to fight for crumbs. So now to our program. Tonight, we'll hear from two presenters whose research demonstrates the health-related dangers that we face and what could be done to make this region a safer place to live. Our first presenter will be Dr. Deborah A. Gentile, noted allergist and immunologist, who has written extensively on air pollution's relation to asthma and the impact of that disease on our youth. Dr. Gentile will be followed by Dr. Wuyue Yu of New York University, a post-doctoral fellow who focuses on cardiovascular and respiratory issues related to air pollution. Dr. Yu will talk about NYU's research on the 2016 closure of the Shenango Coke Works on Neville Island and implications for the U.S. Steel Clairton Coke Works. After the presentations, there will be an opportunity for the county council members who have joined us tonight, and I think there's going to be 4 of them, and if they choose to respond, and that'll be followed by your comments and questions. So now it's on to you, Dr. Gentile.
Thank you. Can everyone hear me?
Yes, perfectly.
Okay, thank you.
Yes.
All right, I'm going to briefly present to you on the impact of air pollution on regional asthma outcomes. I don't know why it's not advancing. Here we go. I'm not going to belabor this point, but it's very well known that air pollution causes a variety of health effects. Some of these are very short-term effects, such as trouble breathing, patients having asthma attacks, bronchitis, COPD, even patients with underlying heart disease having heart arrhythmias, heart attacks, those type of problems. There's also long-term problems that we know are caused by air pollution. Some of these are respiratory and cardiac as well, but we also know that there are many others, such as cancer and early morbidity or early death. These take decades to develop. I'm going to focus tonight on some of the short-term effects that we can see in patients with asthma. There are many patients who are more affected by air pollution than the general population. But it's important to remember that we all know these people. Anyone who has chronic disease, chronic lung disease, chronic heart disease, even diabetes, they're going to be more vulnerable to the health effects of air pollution. Older adults, children, and pregnant women are all vulnerable populations. And then certainly people who exercise outdoors regularly, they're going to be breathing in during exercise a higher volume of air into their lungs and have more exposure that way. So we see short-term and long-term effects, a variety of health system effects, and then we have quite a few vulnerable populations that when you add them together, they represent a significant proportion of our residents. Real briefly, how does air pollution cause all these different effects? It makes sense to understand how it causes problems with your lungs because you're breathing air into your lungs. But what happens so that the pollution can actually cause these distal or further away effects in other organs like your heart or your brain or your liver or your bone marrow where you make blood cells? Basically, we're talking about very small, tiny particles of pollution. They're very small and you can't see them. You're breathing them in and they're actually going down into your breathing tubes. And I like to think of the lungs as an upside down tree. So you have a long tube going down your airway and it starts to branch off. And then finally you end up in the leaves or what we call the alveoli or air sacs. And the air sacs then are just separated from our blood vessels that feed the lungs just by a single cell membrane. So these small particles can actually cross from the air sacs and get into our bloodstream and go to all these distal or distant organs and cause these problems. Sometimes I'm asked why do we say the air is still dirty? It looks cleaner. Back in the heyday, decades ago, when the air looked dirty, those were much heavier particles. Those particles, when we breathe them in through our mouth and nose, those particles would get deposited in your upper airway. They would never make it down to your lungs. It's these small particles, the PM 2.5 that you can't see, that are causing these effects. Why focus on asthma? Well, the biggest reason is I'm an asthma specialist. But again, it's an important disease. It's a common chronic disease in both children as well as adults. There are other chronic diseases that are, caused and then triggered by air pollution as well. These diseases all share things in common. They're all what we call multifactorial. They may have, multiple causes or different causes. Not all asthma is caused by air pollution. Not all asthma is caused by, pollen allergies. Not all asthma is caused by cigarette smoke. But all those things contribute. So as far as asthma goes, we have 25 million US citizens with this. About 1 in 11 school-aged children have asthma. We spend over $80 billion a year on healthcare costs. And unfortunately, people still die of asthma. People forget this. We have over 3,500 deaths a year from asthma. And that's very hard to swallow for a specialist like me because we're able to detect this disease and treat it. We can't cure it, but we can treat it and control it. But deaths do happen yet. Many miss school days, which I'll talk about a little bit later on. Adults with asthma are missing work. Parents of children are missing work. Many patients with asthma, if their disease isn't controlled, they're not physically active. That's going to set them up for problems with, potentially being overweight and obese, and then developing heart problems, and then even diabetes. And some people will say, well, what's the big deal? They can just take an inhaler and be better. We can't cure this disease. We can control it with certain medications, but those medications do have side effects. And I truly believe the best way to approach this is by primary prevention, trying to prevent a problem from starting. And then again, there's a cost. This is just a yearly breakdown per person with asthma, what they pay on medications and outpatient, as well as emergency room costs annually. I borrowed this from Dr. Yu's mentor, Dr. Thurston at NYU. And this air pollution pyramid is true for all the different diseases that are caused and triggered by air pollution. We're going to start at the bottom, and there's going to be pollution exposure, widespread. And a lot of the people who are exposed to that pollution, they may have some physiologic, so there might be some changes in how their body's working, and we'll call them subclinical effects, things that we're not picking up based on symptoms or just examining them. So an example for asthma is that if I expose a patient to air pollution, the first thing that's going to happen is their lung function test is going to change. It's going to decrease. That can happen before they even start to cough or wheeze or feel like they have chest tightness. So that happens first. And then some of those patients are going to move on further and actually have symptoms. In my case, this would be asthma, the cough, the chest tightness, and wheezing. And they're going to reach for their rescue inhaler. Then what's going to happen is they're going to end up calling their doctor or their primary care provider, and they're either going to get a virtual visit or going to come in and see the doctor for an acute exacerbation. Then of those, some of them may have a bad exacerbation and end up needing to call an ambulance and going to the emergency room. And of those going to the emergency room, some are going to end up in the hospital. And unfortunately, again, some can die. So you see the biggest proportion here are going to have these subclinical effects and then outpatient symptoms. Asthma is an outpatient disease. We have to track it looking at these outpatient factors. That's really where most of our symptoms are going to occur. It's going to be rarer to end up in the emergency room, the hospital, or have a death. One other thing I want to point out before going into a review of my data is that We have characterized how children's lungs grow and develop over time. And I don't expect you to master this slide, but the blue line on top is showing normal lung growth in a child. You follow that blue line, their lung is growing over time. They can inhale more air and exhale more air. And then they reach adulthood and it plateaus off. And then as we get older, we're going to start to lose lung function. That's what happens normally. In some patients with asthma, they actually have reduced lung growth. Their lungs are not going to grow to their full potential, and that's because there's inflammation in there, and that's causing scarring, and that prevents the lungs from obtaining their full potential. So they're never going to get to the top of this curve. And then some of them are actually going to have a decline earlier. They're going to have ongoing problems with exposure to triggers. And then that's going to, not only impair how their lungs are growing, but also how quickly they start to lose lung function after they're adults. So we know that these patterns happen with all the different triggers of asthma: allergies, tobacco smoke, outdoor air pollution. All of these things have been shown to cause decreased lung growth in children and set them up to have decreased lung function as they become adults. And then even potentially set them up for losing lung function as an older adult earlier than you would expect them. So these are significant problems. I'm going to, over the next few slides, just briefly review the work I've done focused in the Mon Valley. This first slide is from a publication that we had in the Journal of Asthma. It was published in 2020. We had studied 1,200 school children, most of which resided in the Mon Valley. All the children resided near point sources of air pollution. And what we did was we brought these children in. We did a validated survey to look and see if they had physician-diagnosed asthma. And this validated survey also allowed us to know if their asthma was controlled or not. If your asthma is not controlled, you're going to be having frequent symptoms, wheezing, coughing, missing school, needing to go to the doctor. Your parents are going to be missing work. So what we found here at the time that we were working on this study, the World Health Organization had set their standard for annual particulate matter 2.5 at 10 micrograms per meter cubed. We actually teamed up with Dr. Albert Presto from Carnegie Mellon University, who has a mobile monitoring unit. And of those 1,200 students who participated in the study, he was actually able to tell us down to their home address what their annual pollution exposure was. 70% of the kids in this study had annual exposure to PM 2.5 above the World Health Organization limit at the time. And then subsequently, the World Health Organization has decreased that down to 5. All of the children were exposed to levels higher than that. So that's a significant amount of the population. Using our validated survey, we found that 22.5% of the children had asthma that had been diagnosed by a physician. We were blown away by this. We, in general, think that 8 to 10% of the population, particularly children, has asthma. At that time that we conducted this, the national, state, as well as the county rate of childhood asthma was 8 to 10%. And here we are finding 2 to 3 times the prevalence or the number of children who have asthma. And then we were also able to use that survey to look at asthma control. And we found that 60% of the children who knew they had asthma had uncontrolled asthma. Again, meaning that they're sick, they're wheezing, coughing, missing school, they're not sleeping at night, parents are missing work, they're visiting doctors in emergency rooms. Based on state and national numbers, we expected 30% to have asthma that's not controlled. So again, double what you expected. And then we looked at this and we found that the children who were diagnosed with asthma, as well as those who had uncontrolled asthma, it was related to their proximity and exposure to the outdoor air pollution. We controlled for a variety of other factors, that we know influence asthma, and they weren't playing a role in this case. These children near these point sources of pollution, their asthma outcomes were being driven by the air pollution exposure. This is a second study my group did. We published in 2021. And this is an interesting story. When we were doing the school-based screening, and we're actually seeing how these children, how many children had asthma and how it was impacting them, we started some school-based clinics. And I was running a school-based clinic in the Clairton elementary school at the time. And we had come back from Christmas vacation to see the children for their January visit. And this was the day we found out via the news that there had been a fire at the Clairton Coke Works on Christmas Eve, the prior year there. And that fire had knocked out pollution control equipment. And that equipment was offline for months, almost 100 days. And I saw those children coming in January having asthma attacks and wheezing. And as a pediatric allergy asthma specialist, January is not a time when children flare with asthma. Their peak time to flare is typically in September when they go back to school. And then the other time they flare is April to May with the pollen exposure. Typically in January, my clinic is empty. I don't have people coming to see me. So it was quite striking to see that this was happening with these children. That led us to do a large study. I didn't have enough children in that clinic to give us real meaningful results, but it did give me the idea to go ahead and explore further. I teamed up with colleagues at Allegheny Health Network, and we were actually able to go through their visits, both outpatient visits to primary care doctors, urgent care or emergency department visits. And we were able to see in the time frame preceding the fire, so the year before, for 3 months prior to the fire, compared to 3 months after the fire, we were able to look and see if there was an impact in the number of emergency room visits or outpatient visits. So these results are expressed as something called a risk ratio. What that tells us is how much more or less likely is something to happen in one group versus another. So in this case, it's how likely are you to have a visit for asthma if you were residing near the Clairton Coke Works facility before and then after the fire. And we focused on the zip code that the facility resides in. And what we found here, so if you're at 1, that means that the risk ratio is 1. That means the outpatient visits are exactly the same before and after. If we saw the ratio go down to 0.5, that would mean we cut the visits in half. If we see the ratio go up to 2, that means we doubled it. So what we found was that ratio increased to 1.82. So an 82% increase in all outpatient visits from residents in Clairton for worsening asthma in that period after the fire. Emergency room visits, the same thing. We saw an 84% increase. We also broke it down just looking at increases based on pollution exceedance days. And you can see we had more than a doubling, 2.5 times on high pollution days with PM 2.5 exceedances during that time frame after the fire as before. And then we saw similar trends. They weren't quite as striking, but they're still there, 1.58 and 1.7 with SO2 and H2S. So this clearly showed people were suffering. They were going to the emergency room, they were calling their doctor and going in for visits during this time frame, after the fire. More recently, we've done some work looking at school absenteeism in the Clairton School District. We actually obtained this data from the school, and we were interested to see if on higher pollution days were more children with asthma missing school. And what we're looking at here are rate ratios, and this means what's the rate of absenteeism among students with asthma when there's higher air quality index days. So poorer air quality divided by the rate, and the same children on lower air quality days or better pollution days. Again, a 1 means they're exactly the same. So as the air quality index increased, and these aren't big increases, if you're looking at 24-hour daily averages of 10 to 12 micrograms per meter cubed to PM 2.5, you're seeing about a 21% increase here in the number of school absences. And that's not a high, that's not a high amount. That happens regularly there. That happens on quite a few days that we're seeing this type of air quality. If you look at the SO2, you saw the same type of thing. We were able to look at the PM 2.5 two different ways. Sulfur dioxide is a component of PM 2.5. And if you have asthma and you're breathing in SO2 and air pollution, it actually causes an immediate bronchospasm or tightening of your breathing tubes. That happens immediately. PM 2.5 works a little bit differently. It causes inflammation or swelling, and then that swelling that happens causes a bronchospasm. So that often takes a day or even longer to develop. So we looked at that factor based on next day. So if you had a PM 2.5 elevation today, we looked to see tomorrow how many children were absent. Whereas the SO2, we were looking at the same day levels. We also looked at more chronic exposure to PM 2.5, a 28-day daily average, and it was very similar. So the bottom line was we have a high prevalence of asthma in these school children, a high ratio of them having uncontrolled disease, and it's actually impacting their school attendance. And some people have asked me, what does this translate to? This translates to these children with asthma missing almost 2 more days per year. And that's significant. The school districts in general like children to only have 10 excused absences or less per year. And if their baseline starting at 6 to 7 days per year, as we were with this group, and they're adding another 1.7, that's getting them very close to where they become concerned. So this can impact their education as well as their socialization. So again, this is the summary. We have poor asthma outcomes in the Mon Valley, and it's associated with air pollution. It happens with both chronic as well as acute exposure. The chronic we showed you with the, looking at the school children, the prevalence. The acute, we showed you what was going on with doctor's visits for asthma during the Clairton Coke Works fire. Again, this impacts a variety of different populations, children as well as adults. And then again, the newer thing here is that we found this impact on school attendance. And that does have some significant implications. Children who don't attend school on a regular basis are going to have difficulty learning, worse grades. They're going to, be set up to just perform poorly as they advance through the school system. And this could actually impact their ability to get post-secondary education or good employment. And then the other thing is they're missing that social aspect in exercise with sports if they're missing school. So those are all important things. Again, I focused on asthma, and one of the reasons we focus on that is because we can measure some of these short-term effects. We don't have to wait decades for cancer to develop or people to have premature death. Many of these airway or breathing outcomes, as well as the heart outcomes, we can see happening very quickly, so they're an easy way to measure. But I just put this up here again to remind you, asthma is just one of these problems that are caused by air pollution. There's many, many more. And again, they're listed here. And then when I look at this data, I've been doing this now for 12 or 13 years. And, it's surprising that we just want to focus on putting a Band-Aid on the problem. We know air pollution contributes to the development of asthma and asthma exacerbations. It's not enough to just give someone a medication that can cause side effects. We need to do more to prevent this problem. Yes, our air is getting cleaner, but we're still not at the updated standards that have been put in place recently by the EPA. As time goes on, we get more sophisticated with our studies. We study many, many more patients. We have studies now with millions of patients in. We're finding as we expand these studies that we're finding and documenting that lower levels of air pollution than previously thought are causing these health effects. So there's really no safe level here. And we do have to make an effort to prevent this problem. And again, it's not just asthma, it's people who have all these other problems, COPD, heart disease, cancer, premature death. The other thing I'm always struck by within the county is that we have no effective real-time alert systems. When these patients are exposed to elevations of pollution, they need to remove themselves from that pollution as soon as they can. If we're not telling them there was a pollution spike until the next day, they've missed their opportunity to prevent an exacerbation. We have to be able to communicate to the media when these events happen, and then we have to have the media be able to broadcast this to everyone. Not everyone has a cell phone or the internet. Some of these patients are missing out. We need to do a better job at that. So I'm going to go ahead and end there, and then I will turn this over to Dr. Yu. Okay.
Here we are. Today my talk is going to be more about the potential health benefits of Clairton Coke Works emission reduction based on the lessons we actually have learned from the shutdown of Shenango Coke plant. The motivation of our work here is basically to look at an example of a real shutdown and see whether or not we actually see a real health benefit. If we do, that will be a very good motivator for future actions. An overview of my talk today will first look at the underestimated health impacts of coking-related air pollution. Dr. Gentile gave a very good description on the air pollution and health effects itself, so I'll be skipping a little bit in there, but focusing more on how coking-related air pollution might be more toxic than other species. And we'll look at the Shenango shutdown in 2016 and the health benefits we see after that. And some of our more recent work doing emission reduction scenario dispersion models, looking at the emission sources at different industrial emissions points, and looking at the terrain pattern and the weather pattern to see where the pollution actually goes in the area. And that way we can actually identify the hotspots of exposure and see where we will receive more health benefits. And I'll finish by looking at some environmental and health policy implications. So this is a third time a reminder of air pollution has systemic effects throughout the body. We have heard a lot about respiratory disease, mortality and morbidity, potentially lung cancer and pneumonia. Air pollution also is associated with infectious diseases. And of course, asthma. There is cardiovascular disease impact. We've seen causal effects with myocardial infarction, heart failure, and we see stroke, diabetes, high blood pressure, and reproductive health effects like premature birth and decreased birth weight. So the effects is actually throughout the body. And why is coking-related air pollution more concerning than other sources? If we look at air pollution, they do come different sources. There is wildfire, there is traffic-related air pollution. We see different emission sources in our life every day, but coal-related or coking-related combustion from fossil fuel could potentially produce a more toxic type of particle that goes into the air. There are a few things that make them eventually causing potentially more effect. From coke oven emissions, we see higher concentrations of SO2 and hydrogen sulfide produced. Hydrogen sulfide will be oxidized into SO2 in the air, and SO2 is a major airway irritant, which induces bronchoconstriction and asthma exacerbation. That is an immediate acute effect. While for PM 2.5 or even smaller, from combustion sources, these particles are actually smaller in size. PM 2.5 is smaller than 2.5 micrometer, but most of the combustion sources, the particles that comes out with is under 1.0 micrometer. So once they're smaller, at the same mass concentration, when we're talking about 1 microgram of it, it is very much smaller particles. So there is actually a higher number of them. And as we have already heard, they do go deeper into the respiratory tract. Also, with the SO2 that is already in the air, they will capture and be a vehicle for those SO2 gases to enter further into the airway and induce irritation there. In addition, these particles are actually enriched in transition metals that will actually also induce oxidative stress, inflammatory response, and systemic effects. These particles, once they actually enter the respiratory system and into the alveolar region, they can actually cross the boundary between the alveolar region and our blood, and then translocate to other parts of the body. People have seen them actually in heart tissues. And these particles, once they go systemically, could have effects such as longer-term COPD, asthma pathogenesis, decreased lung function over time, and also induce sclerosis, coronary artery diseases, and sudden cardiac death. Also, in addition to SO2 and the smaller PM particles, coke oven emissions also contain large amounts of volatile organic compounds, benzene and polycyclic aromatic hydrocarbons, and so on. And coke oven emissions in general is classified by the EPA as a group A, known human carcinogen. So they're they're causal for lung cancer. And comparing coke versus overall PM 2.5 effects, this is a comparison using pooled analysis of previous source-specific epidemiology. So basically, previous researchers have looked at effects from co-related PM 2.5 and the overall PM 2.5. What we found by pooling their estimates is that co-related PM causes all-cause mortality at a per unit or per unit mass basis. It is 3 times more likely than the general PM 2.5 particles. So all the estimates and all the standards we've been looking at actually uses the general PM 2.5. All these were based on something that is 1/3 toxic as coal. What may actually make it worse is that coking essentially is a coal purifying process. The process of coking or pyrolysis is essentially purifying coal to more pure form of carbon, coke, and all those impurities is actually released. Comparing coal versus the remaining versus the released in the product. So we are seeing that the coking process will actually release large quantities of arsenic, lead, chromium, and cobalt, which are all known like carcinogenic or toxic metals. And this is basically a concentrated version of coal PM. And so we were interested then to look at the actual closure of the Shenango Coke plant. The Shenango Coke plant, as I believe a lot of you are very familiar with its shutdown and its history. So the Shenango plant was built on Neville Island around 1930. It's around 10 years after first Clairton Coke battery was built. So they were roughly from the same time period. The Shenango Coke plant was closed on January 7th, 2016. The last day of operation is 6th, and the emissions actually continued into the night. So before the closure of the Shenango Coke plant, the production size there was around 10% of the Clairton Coke Works plant, and its emissions, it differs by type of particles and gases we look at, but it's roughly 10% of PM, 20% of SO2, and 35% of volatile organic compounds released compared with Clairton Coke Works. So somewhere around the 10 to 20% of the actual emissions from Clairton. The residents have been subjected over there to high levels of exposure and have been protested for years before the closure. It is eventually the community pressure and decline of domestic steel industry together that actually made the shutdown happen. So we looked at the air quality and actually health impacts of the shutdown. Shown here on the right-hand side is a dispersion model. Dispersion modeling done here is using the emissions from different parts of the facility to consider different points and different lines as the emission sources, and used the geographical terrain pattern and the weather pattern in the area to see where the pollution from this plant actually is going to go. In the model, we see that from the shutdown, the actual decrease of PM 2.5 will be up to 0.35 microgram in the zip code right next to the plant, not on Neville Island, in the Avalon zip code 15205. So in that area, we saw it up to nearly 1/3 of a microgram decrease solely from the Shenango emissions. And taking a closer look, our health research basically took place in these neighborhoods, going from Shenango plant, the zip code surrounded and a little downwind. And we looked at for air pollution, this one. Here's a Allegheny County Health Department air quality monitor. That monitor is located right across the river from the Shenango Coke plant, very close. And at that monitor, what we actually saw was a 90% reduction of daily SO2 levels right after the emission, before the closure versus after the closure. And at the same air quality monitor, we also saw a 0.8 microgram reduction of daily average PM 2.5 level. So in the neighborhood, we actually looked at health effect. The health effect endpoint we used is further up that pyramid. We look at emergency department visits so it's more severe cases. In terms of cardiovascular effects, what we saw in the Avalon or the near Shenango site is that we're looking at a figure showing in those over 65 years of age, the cardiovascular emergency department visits were on the increasing trend before the closure. And right at the week after closure, we saw a 19% reduction of the emergency department visit rate. And that's not just it. It kept going down over the years because the effect itself is actually systemic, and our body would actually heal and clear all the particles over time gradually. So we did see both an acute and a longer-term health benefit right there. If we look at injuries as a control outcome, which is supposedly not really impacted by air pollution directly, that did not happen. So the shutdown of the Shenango plant at that time point is actually inducing only effect in the biologically plausible or the effect the cardiovascular effects here. During the same time, there is a unchanged also upward trend near the Clairton plant. And for respiratory health, we see a slightly different pattern. The respiratory emergency department visits dropped immediately after the Shenango Coke plant closure. The drop there, this is for OH in the same zip code block groups. So what we are seeing there is that there is a roughly 20% decrease of weekly respiratory emergency department visits, also right after the shutdown of the Coke plant. It went on very similar trend as before. So there is no real longer-term health changes in the respiratory emergency department visit outcome, but the 20% decrease is still there. Well, at the Clairton neighborhood, the story is different. The Clairton neighborhood actually had a larger and increasing number of respiratory emergency visits over the years, especially going into 2017 and 2018. It is even higher than the predicted trend using the pre-closure years. And this is for pediatric asthma visits. So what we did see in Dr. Gentile's presentation is that the increased air pollution has caused an increase of absenteeism related to asthma attack. And here we're looking at a slightly different direction example. If we decrease the air pollution, we will see a decrease in asthma emergency department visits. And here we saw that the monthly pediatric asthma emergency department visits at the zip codes near Shenango Coke plant was reduced by around 40% right after its closure. And it also kept going down over the years. And meanwhile, near Clairton, these kind of change did not really happen, and the numbers has been increasing more recently. So seeing the health benefits at Shenango, we ask what if? So what if we actually reduce air pollution at the Clairton Coke Works? This is a dispersion map looking at in the scenario of shutting down batteries 1, 2, and 3, which actually happened. Batteries 1, 2, 3 consists of around 20% emission numbers from the baseline years. And we're seeing that according to our model, the annual average reduction is estimated up to a 0.2 microgram in the closest zip code to the Clairton Coke Works. That is around a little bit more than half of the biggest reduction we see from Shenango shutdown itself. Because the total emissions from Clairton is larger, and they will disperse a longer distance. So actually more zip codes will be impacted by the Clairton Coke Works emissions than by the Shenango plant. So a reduction of Clairton plant is going to actually give us a larger, much larger area that is going to see a comparable health benefit. So what if we have an even larger reduction? Here we're looking at a case scenario if we are cutting the emission from the Clairton Coke Works by half using the 2022 levels. So in the case of 50% emission reduction, we're actually going to see large health benefits and large air quality benefits in the much larger area around the Clairton Coke Works plant. And the biggest reduction number is estimated up to 0.37 annual average level. Now that's around the biggest decrease we actually see in the zip code next to the Shenango plant from a full closure. And Here we're seeing more potential for public health benefit. So the implications are there is significant health benefits actually seen in the community residing near the Shenango Coke plant after shutdown. And reducing harmful emissions from the Clairton Coke Works can actually bring clean air and public health benefits to communities residing in the Mall Valley. So what can and should actually be done? One key thing is for sure to clean and modernize operations at Clairton Coke plant. Nippon Steel actually had some communications talking about the methods they want to actually use, called Super Course 50. It is basically a hydrogen. They're going to inject hydrogen in blast furnace in steel making. It is not dissimilar as the cleaner direct reduction iron making technology. What it does is just adding hydrogen in the process. It still uses coal. Because hydrogen is added and there's carbon sequestration in the later phase, it can partially reduce its CO2 emissions, greenhouse gas emissions. However, the toxic components we talked about, it is not really clear whether or not it actually reduces those from the coating process and from the emissions. And it is very important to have a better accident and violation prevention system. That means inspection, maintenance, and upgrading the facility. And also more active communications with local residents. And also, as Dr. Gentile have suggested, we need a better monitoring and alert system. One thing is to properly fund the Allegheny County Health Department's air quality program. And also, it is necessary to actually to create a collaborative personal air monitoring network. We have universities around, we have clinical care facilities around, we have other places where we can actually do air quality measurements. It is important to actually identify the neighborhood at higher risk and establish effective and real-time monitoring network in these communities. We need air quality monitors where the children are, where the older adults are, where those who may actually already have chronic disease are. They are the people who actually need their air quality exposure levels measured. And we need an air quality alert system that is going to be communicated by different channels so that it reaches everybody. It's not only that an alert that will tell you this, we are now in high air pollution episode. It also has to include what you should do. Should you stay inside, use mask like an N95, or should you have a filtration system on, and things like that. So together, we could possibly utilize this as our public health opportunity and clean up the Clairton Coke Works, right?
Well, thank you, Dr. Gentile and Dr. Yu. This is a chance for members who've attended to post in the chat any questions you have, so Mark Dixon can triage that and call on you. And also raise the question of whether any of our county council representatives who are at the meeting would want to say anything at this stage, or prefer to wait until the questions are asked.
We have a question from...
I'm happy to say a few words, Howard. This is Paul Klein. And thank you for convening this. And thank all of you who have been attending these town hall meetings on a regular basis. And we're now up to 16. And I appreciate all the work, all the efforts that all of you have put into bringing this to a larger audience, in the hope that someone or somebody can make a difference and respond. And I suppose that at this moment, that body is Allegheny County Council. So, as all of you know, not to reconstruct history, but obviously, almost a year ago, the county health department, at the urging of the EPA, determined, that this is something we had to address, and we're considering a mitigating measure, the increase in fees, permitting fees, and fees that are associated with asbestos removal and other abrasives. And the thinking on the part of the health department at the urging of the EPA was that we have to address this. We have to get this done in some way. So I would begin with a simple apology, and that is I apologize to everyone who is living in those communities that have experienced the greatest health impacts of particular pollution matter in this region. And I apologize for the uncertainty with which you've had to live in the hope that county government, county council will do right in effectively deciding that public health ought to be a priority. My committee, the Committee on Health and Human Services, took up this matter in October of 2024. And we had several committee meetings in order to consider all of the concerns that members of council might have had. We heard from the health department, we heard from Dr. Rabinowitz, others in the health department as well, explaining what the purpose of the fee increases were, how that money would be used, how it would effectively help the county health department do the work that they are charged with doing in terms of dealing with this situation. And the objections I most often heard was, it's too expensive. It costs too much. It costs too much. Nonetheless, it left from our committee. Our committee recommended that this be presented to the full council, and it had our full support. To date, of the 15 members of council, we have 8 members who are in support of this particular ordinance, this particular regulation. But because revenues are involved, we need 10 votes. And so that is where we have been sitting for many, many months now. And our goal is and has been to hopefully move some of the members who are not supportive to join us in this effort to demonstrate that in Allegheny County, public health is first and foremost our priority. It's good for the health of the people who live in this region, and really, believe it or not, it's good for business as well. So I'll pump the brakes here, and I will defer to any of my other council colleagues. I believe 3 other colleagues are here tonight. If you might like to say something, or if there are questions, we are here.
Dan or Bob, do you have anything that you'd like to say?
No, you can go, Michelle. I think the only thing that I'll add is that, I've been someone who's been in favor of this fee increase throughout the entirety of the process. And I think, the clear framing is that this is the cost of generating these Title V permits, right? And over the years, all we've been doing as taxpayers has been subsidizing our worst polluters through these costs. And I think that's just a really important thing to keep in mind, that we basically have 2 options if we don't increase these fees. Either one, they're going to be borne by the taxpayers, which none of us wanted to increase taxes last year, but it was something that 10 of us chose to do because we thought it was best for the county. Then the alternative to that is that our air quality program will fail to function as it properly needs to in order to hold our polluters accountable. So that's all I have to say. Thanks, Michelle.
Bob, do you have anything you'd like to share?
The most part, I just I'm listening. I worked in the steel industry. I have family worked in the steel industry. I lived in the Mon Valley all my life. I've seen the progress that's being made, and I'm not sure that fines is an answer. I think that U.S. Steel has done some technological improvements, and they're moving forward. But I believe that there's a lot more that goes along with health issues than just one steel mill. And I believe that the Shenango experience far exceeds what we're experiencing here. And then that was 10 years ago, 9 years ago. I'm willing to give U.S. Steel and Nippon Steel an opportunity to make things right. But like Dan said, I'm not ready to go after the taxpayers any more than we already have. And I'm just not sure where the fines are going to go unless they're dedicated. But I want to make sure that we do live in a healthy environment. And there's some other mitigating circumstances that go along with the children having asthma and other issues. So I appreciate the reports. I appreciate the information. And I want to see how this goes down the road. I don't believe we have a lot of time, but I'm willing to give U.S. Steel and the Health Department a little bit of breathing room. Thank you.
Thanks, Bob. There's some information in the chat that you can refer to in terms of the discrepancy between fines versus fees. And so what's being proposed aren't fines. The fines are when they exceed the emissions in violation of those standards that are met. Those are the fines that go into a Clean Air Fund. These are the fees to take a thorough review into the permitting that is required for each of these facilities. So Michelle Nakarati Chapkis, everyone, I'm hiding in my daughter's bedroom away from the dogs because they're barking this evening, and so I don't want to cause commotion. And so for many of you, I know many of you here, and it's nice to see colleagues and friends. Personally and professionally, this is the space I'm in, so I really wanted to be committed to being here. Personally, I have a child with asthma, and I've dealt with that since they were about maybe 18 months old. And so I have been at a lot of doctor's visits and EDs and sent nebulizers off to childcare centers and made sure she had her albuterol whenever she was going to a sports practice. So I live it through her. The other thing is that y'all probably know that I also work with an environmental health organization. And so we send out alerts on poor air quality days to childcare centers and schools with direction for what to do and to make sure that people are staying indoors for recess and phys ed and after school activities. In addition to that, we distribute lots of air filters to residents in need. And so this issue certainly resonates with me wearing several hats. This has been a complicated, as you all have been through the process with all of us, issue. And so, I want to just share a couple of the things that I've shared. I've been working really hard on this for several months now, talking with the administration, talking with colleagues, talking with those individuals who raise concerns in the community about this as it relates to driving or deterring economic development. So I'll just give you a little bit of sense of what that meant. I will just be completely transparent because you expect that from your public servants, and so I will share that with you. One of the as you all know, these bills are coupled, and one is on the air quality permit fee, and the other one is on the asbestos fees. And both of these costs that had been estimated were built into this year's budget. So that's something that people need to know, is that the county's budget was including that this would pass and that these fees would be included in that budget to operate their air quality division of the health department. So, there is a concern that if this doesn't pass, that, that would be a great hit to the budget and what's needed for all of those people that are working hard to reviewing all these permits. And so, That's the first thing to share. The other thing to share is that I think that there is a path forward for the air quality permit fee to getting 10 votes. Because it's coupled with asbestos, that's a little bit of the challenge. So just to share with you the asbestos story, so that everybody has a point of reference. There's a little bit of concern about the structure of the asbestos. And I'll use this as an example that I had shared with someone earlier. We know that we're losing revenue in downtown Pittsburgh as an example. There's so many vacancies, a lot of reassessments, and those values have gone down because of those vacancies, and that is impacting the bottom line and the money that the county has to operate. So we want to drive people back to downtown, and we want to make sure that we can get those buildings rehabbed and hopefully occupied, whether they're repurposed or they're for commercial or residential use. So the questions that have arisen that haven't necessarily been teased out and answered related to asbestos is that if we had one of those, let's just say a 20-story building in downtown that needs to have a rehab, and we have a contractor that's going to rehab floors 5, 6, 7, 8, would they have to pay for a permit separate for floors 5, 6, 7, 8 if they're doing that work as a project? Or could they do one permit fee for that project that includes all 5, 6, 7, 8? So those were some of the nuances for the asbestos that are trying to be worked out and resolved with more clarification. And so what I have been told with my recent discussions, as recent as last week, with the county executive's office, is that they're working on trying to come to a resolution on the asbestos component of this, because there was not the willingness to say, one of the other things we had posed, I had suggested, let's move forward with the air quality permit fee. Let's get that one taken care of. And then let's come back to the asbestos and let's get that taken care of. There wasn't the ability or the interest in moving forward and decoupling, for lack of a better word, those two bills. So they'll stay together as far as I know. And so I think that, I'm hopeful that while we're on recess between now and August 19th, that there will be some action and movement amongst the various parties so that some of that confusion related to how they approach the permit fees on the asbestos side can be addressed and there can be some clarity around that. But I do feel that the air quality permit fee is going to move forward in a way that's positive for all of us. So that's the scoop that I have in terms of what I've been trying to work toward for all of us, for the region, for our kiddos.
Well, thank you to all of you for speaking. I just a couple of points of order. I think Michelle mentioned this, but I just want to emphasize it, that we're not talking about fines here. We're talking about a fee increase. We're not talking about a tax increase. So there's no implication, no impact on residents. And, to go to the reason why all of this is an issue is there's a tremendous backlog on Title V operating permits at the Allegheny County Health Department. Some companies are operating, they never had a permit. There are permits that are out of date since 2012, 2015. So it's a question of trying to bring this up to a standard. And by the way, the EPA has admonished the Allegheny County Health Department on numerous occasions that they have to figure out how to get rid of that backlog. So this is a way to get there. This is a way to try to protect the public without costing anything for taxpayers. And, the reality is it's hopeful that, Nippon Steel is the new investors, whatever that terminology is at U.S. Steel, will be a good citizen and figure out how to clean up the act. But in the meantime, Allegheny County Health Department has to do its job and get rid of that backlog. So
Howard, those are really great points, and I'm glad that you were that you shared those. Just to speak of the backlog is there's such a significance there. And frankly, we and all of our colleagues, we've known this, as you mentioned, since 2018. It's very frustrating and unfortunate that we didn't have these conversations in 2018-19. And so we're playing catch up, frankly. And the way that the air quality permit fees have been written now, if you would look at what the EPA has written and identified as the formula by which you should approach these fees, the way that they're presented in this package with the air quality permit fees actually is a savings to all the Title V permitted facilities. They're paying less than that EPA formula by quite a significant savings. So, that's something else that we can lean into and demonstrate and share, is that these fees, as they're being presented right now, are less than what the EPA's formulations would require them.
Thank you, Michelle. So are there questions, other comments?
Lots of questions and mostly comments in the chat. There was a flurry of comments related to the fee versus fine issue.
My apologies.
Thank you, Bob, for addressing that. Appreciate it.
Yeah.
I think that there was one, let's see, early on, sorry, I was just scrolling up. What entity in Allegheny County is responsible for measuring air quality and reporting that? Oh, and then somebody answered that, but if anybody would like to, Howard, if you'd like to just pick that up briefly.
Just repeat that for a second, because
I think the answer is clear to many of us. What entity in Allegheny County is responsible for measuring air quality and reporting that? Allegheny County Health Department primarily.
Yep.
Yeah, but there's a lot of other monitoring that goes on. There are purple monitors. You're the expert on those, which are pretty ubiquitous through the region. And the Breathe Project has on its website, they have Breathe Cams, videos that are zeroed in on polluting industries. We're talking today about U.S. Steel at the moment. So that's additional information. CMEO Create Lab has its Smell Pittsburgh app, which, by the way, the Allegheny County Health Department was a partner in helping to develop at one point in time. You, Mark, are the expert on how many reports of exceedances that people notice have been lodged over the years. What's that up to now?
Oh, I think certainly past 80,000 smell complaints above level 2 out of 5.
Right.
But it keeps going up. We might be approaching or past 90,000. And that's since 2016. So tens of thousands of smell complaints registered regularly. It still smells in my neighborhood, certainly in Squirrel Hill South, but you can see them all over the map in the Smell Pittsburgh app. And there's a website for it that I just posted in the chat. Clearly a present concern, not a historical concern. There's another question that came up. Let's see. Lisa Graves Marcucci asks, are members of County Council aware that the ACHD is still without a hearing officer and that is an impediment to proper oversight and enforcement of permit cases? Is there anything County Council can do to see that this important position is filled sooner rather than later? That's an excellent question. Love to hear feedback from our council people in attendance. I can repeat the question. It's also listed in the chat at 8:18 p.m.
Yeah, I think my understanding is that that has come to our attention, and my understanding is that they're working on it. I mean, I think that Dr. Van, the health department director, outlined early on what her priorities were, and I think that the health department has not gotten the attention that it really needs in order to do this important work, as someone referenced earlier. It's quite true for a number of years now. So I think that in terms of setting the ship straight, there's still considerable work to be done. But I know that that is something that is a priority, and we're expecting it'll happen sooner rather than later. But there is some sense of urgency around that, I think.
We can certainly reiterate the need and stress that with the county executive's office. So we'll take that back and reinforce that. There's that position. I had just talked about another position that's really important to be filled, the Human Relations Commission. So if you know anybody who's interested in applying for that, please do. That's really another significant position that's available right now that they're trying to fill. But both of these are pretty critical, certainly, and impact people's daily lives. And so we'll bring it back to them and reinforce that that's something that we hope they'll put as the priority.
I'd like to add that even in a perfect or a historically funded scenario with the health department, the regional polluters have not achieved perfect performance. There's still illegal pollution persistently in the region, and that's even with a health department that has gotten the funding that it sort of requested, or at least there wasn't this same circumstance of funding crisis at this level. And so it would seem that until we have high levels of compliance, that increasing the ability to hold polluters to account seems appropriate. Otherwise, it's either we pay enough for a good, healthy regulatory infrastructure, or the community pays through individualized medical bills, loss of wealth, loss of attendance at school. The community will pay if the health department doesn't receive appropriate funding. And even then, the community historically has paid, but the community will pay more without this funding. And so where does the cost go? Who can afford it more?
So I just want to add a couple of things. First of all, not everybody may be aware of this. Our guests from County Council and others, this is a totally volunteer operation. I volunteer my time to convene this group. I'm part of the Breathe Project because of a small group that I started in the East End called East End Neighbors Fight Pollution. We began this years ago. We continue to work on it to the extent that we can make a difference. The bottom line here for us is that we try to amplify the voices of residents who bear the brunt. I think Paul Klein mentioned it, maybe others have it as well. Obviously, it's worse in places like Clairton and Braddock, and we can name all the places, but all of us are affected one way or another, depending on which way the wind's blowing. So that's one piece of it. And the second piece of it is that, as residents, obviously we're taxpayers. We would hope that the county council would come to the conclusion that there is something to be done here that could make the situation better. And, we've been, for the last year, really abiding by the request of the leadership of the Allegheny County Health Department to do whatever we can to help promote this. That's what we've been doing. And hopefully this evening can make a difference. Mark, you have your hand up.
Yeah, I just would like to continue to hit more questions in the chat, if that's okay.
Yeah, go.
Okay, great. The next one down by Theron Gilliland Jr., pardon me for not maybe pronouncing your name properly, writes, is there some reason that polluters shouldn't get fined so harshly that they actually take precautions not to pollute and or fix the problems when they do?
Mind if I take this one, guys?
Yeah. Oh, go ahead. Oh, sorry.
In my opinion, no. I think that is exactly what should happen, right? I mean, there clearly needs to be some sort of impetus for folks to change behavior. Councilman Macy mentioned both the Shenango plant on Neville Island as well as U.S. Steel Clairton. I actually worked at both places. My first internship was as a chemical engineering intern at Neville Island. I was there whenever it closed down. I can tell you firsthand that they were not incentivized to change their behavior due to fees because they were not large enough in nature to justify the changes necessary for their pollution control equipment. And the same thing was true at Clairton. I was an operations manager for the utilities department in Clairton. And again, $1 million, $2 million a year does not provide the financial incentive for a corporation to spend the hundreds of millions of dollars that are necessary in order to come into compliance. The only ways in which a corporation will change their behavior is either one, like you said, if fees are so great, or if financial assistance is so great that it incentivizes that behavior from a business standpoint, or two, if there is some sort of metric placed such that companies need to hit those metrics or they'll be forced to shut down or potentially pause operations. So that's just my personal opinion.
Thank you, Dan. Matt Mihalik here has got a hand up, and I think let's pivot to Matthew, and then let's go back to the chat. Go ahead, Matt.
Thank you. I appreciate it. I want to thank the county leaders here today. I so appreciate your being here and for all the work that you do. This is a really critical time for county leadership. You are actually now the frontline support system of protecting our health as the federal system is wobbling. You all stepped up in 2023 and 2024 and passed a resolution calling for improved standards for fine particle pollution annual average. You passed a resolution asking for an 8 microgram standard. The EPA delivered 9, and I want to say that they probably would not have gone for 9 if you all on county council hadn't passed the resolution asking for 8. They probably would have put it at 10. Okay, so you all, I want to commend you all and thank you for stepping up for making that happen. All of us nationally benefit from that. The county government that houses, a major steel industry stepped up and said we need to protect county residents. Now, what I want to say is you all are going to be called upon very soon to defend that standard. That it's likely the federal EPA is going to try to undermine that and roll that back. And what's good about having a local air district like we have in Allegheny County is that we have the ability to say, you know what, EPA, we're going to stick to the 9. Our county health department has the ability to do that. So we are going to need to stand behind you all and support you all to hold the line on any sort of rollback like that. And so thank you for being here tonight and for going through all of this. But we need you, and we need a well-funded health department. The second thing I want to say is the Treasury Secretary was here along with the President at Carnegie Mellon. Part of their discussions today was celebrating the Nippon Steel deal as a remarkable achievement. Now, what I want to say about this deal is U.S. Steel got everything it wanted. It actually has price guarantees from tariffs. They have a guarantee that the plants will stay open through 2035. They can't reduce personnel until the year 2030. They're guaranteed profits. And Nippon pledged $11 billion, $11.8 billion in investment and $2.4 billion in Allegheny in the Mon Valley. Okay. That means the money is there to pay for these permits and to fix these facilities up. During the 2018 Clairton Coke Works fire, when many of us were advocating for hot idle, shutting Clairton on to hot idle, U.S. Steel came back and said, we can't do that because it will ruin our Coke batteries and that will cost us $400 million to fix. Okay, guess what? They have a bank from Nippon that far exceeds $400 million. They can fix all of this. So there's no excuse anymore. We can't hear the excuse, oh, we're going to have to lay workers off, or, oh, we're not making enough profit so that we can't afford to fix it, or we don't have the capital to do it. Actually, all of those things are available. The only reason why those things would not happen is greed and manipulativeness at this stage. And anyone who is covering for a company that has all of these gifts and yet aren't standing up and saying we need to clean up the Mon Valley so people can actually live healthy lives and not be exposed to pollution, there's no ground to stand on anymore. You don't have that position anymore. So we need to hold the line on the standards and fix the problems because the money is there. Our Treasury Secretary is bragging about it. So thank you, and thank you for allowing me to share those perspectives.
Thanks, Matt.
Thank you, Matt.
You know,
well received.
Again, I'm not an apologist for U.S. Steel, for one thing. This is where I've lived my whole life, and I've seen what's happened to the Mon Valley in a variety of different aspects. Crime, can't even get buses down here. We have a lot of issues. However, I promise everybody that's on this call that I'll be working with my colleagues on the health department, on the health committee, and I think we're going to come to a resolution. Thank you.
Thank you. Mark, more comments in the chat?
Yeah, it's overflowing with comments, and I'll apologize in advance if we miss yours or can't get to it for time, but wonderful, wonderful, thoughtful, detailed comments. Okay, there's another one from Jim Highland. Does this need to be voted on in just one meeting? And what will it take the rest of this month to get the objections regarding the asbestos part of the legislation worked out? When is the next time there is a meeting between the county executive and others to work out those differences?
So I'll just say that in my very, very, very recent conversations with the county executives team, that they're working diligently on that, and their goal is to have a resolution on the asbestos by at least the end of August, so that in September, the timeline is, we're hopeful is that September, then we can get this on a vote in front of county council.
Thank you for that. There were several comments that were happy to hear about the sense of urgency, grateful to have attention paid to the hearing officer, multiple likes and encouragements of that. Okay, so another one. Okay, and then let's see, Michelle answered the other one about what the fees would go to from Laura Gallagher. Thank you for answering that in the chat. So the question was, will increased fees in light of the billions and billions of dollars in profit accrued by the steel industry allow ACHD to have full staffing, perhaps making the backlog less of an issue, the backlog of permits? And Michelle mentioned yes, Lisa, in the chat, just for those who are just listening today. Yeah. Brian Juice writes, it's time to put forth a counter proposal in recognition of spiraling inflation, et cetera, for costs of living, including services such as permit reviews. It's time to dispel political undercurrents. No one can argue with increases for services across the board. Also consider incentive to sources that meet permit requirements in their fee for next year. That's just a comment. So yeah, wanting to help encourage folks to meet their permit requirements. Okay, so Laura Gallagher writes, okay, and Michelle answered. Thank you, Ms. Nakaradi-Chapkis, but is the decoupling legislatively impossible or too lengthy or just too complicated or opposed by all council members? Michelle writes, it is a bit complicated and therefore not the preferred path by the county.
I haven't actually even shared this with a ton of other council members. It was just one of the mechanisms that Matt's laughing, but so, you know, probably if you ask some council members, they may have no idea what you're even talking about whenever we mention it, whenever that's mentioned. So it's just one of those kind of things that we've been trying to identify some new alternative approaches. But it is a bit complicated, and there's some legal interpretation about going out for public comment and what that would, is that necessary, and does that delay process and such. So it's not impossible, and it could be an absolute last resort if necessary. But at this point, you know, we're trying to really work hard for that month to that month of August to come back in September to get something passed.
Super. And I appreciate yours and all of the council members' candor this evening. I think that really helps us have a conversation where we can reach new solutions and gain a deeper understanding all around. And I think that helps everybody out. Marin Cook writes, another thing to note, it would be good for the Air Advisory Committee to be less dominated by industry. GASP used to have a slot on it, but hasn't since the group's change of executive director. And there are lots of likes and hearts to that comment. Another thank you for the efforts of the leaders of these Zoom air quality town hall meetings. On behalf of the group, you're welcome. Okay, another one. Okay, this one would the from Bellevue at the health department air quality meetings. U.S. Steel is always heavily represented by U.S. Steel staffers, engineers, and lawyers. Would this permit fee increase even touch the salary level of one of those U.S. Steel employees? Yeah, no, I think the company can afford the fee increase. Okay, just a comment. Lots of likes on that. Will council member from Susan McCarthy, will the council members here this evening share about the county CAP plan, climate action plan, I believe, and the upcoming neighborhood events? Will council members be at these events to hear and learn from residents? And Michelle writes, we will certainly share. Thank you, Michelle. During our committee meeting, we discussed some opportunities for outreach efforts. Excellent. Just cruising along here. Thank you for your advocacy. Okay, others encouraging, just go ahead and find them.
I think the fine, let's not lose sight of the fine discussion, because the fine discussion is not the air quality permit fees. We already talked about that. But related to the fines go back to those most impacted. And so that's the other thing that we, everybody here already knows, is that they're the communities that are most impacted by those violations need to have access to that funding to put investment back into their community from a public health perspective, to put those, and do like VCAN has done with purchasing air filters and distributing them across community. And so, that is one thing that perhaps some people don't know, is that the fines go into the Clean Air Fund, and the county health department has put a lot of, and through Dr. Gentile's work with the lawsuit with several other nonprofit organizations, to ensure that the fines get back into the communities that are impacted by the emissions.
Well, can I just interject just a couple of things at this point? First of all, thank you to the representatives of County Council for attending. We had 2 town halls that Sarah and Amarato attended. One when she was part of the primary election, one when she was running in the general election. The fact that we have 4 of you here today, Paul's been part of this on occasion as well, means a lot. The feeling that we can actually communicate with our representatives, I think, is extremely important. And just as important is to be able to hear the feedback from others. The fact of life is there's a reality in our region. We haven't grown, we have shrunk. Once upon a time, Pittsburgh was 675,000 people. And today it's 303,000, I think, the last time I looked. Once upon a time, Allegheny County was 2.25 million. It's maybe 1.2 million today. So we need to revitalize this region. And part of the revitalization is, if you take a look at younger workers, they are concerned about quality of life. We need the kinds of projects that are going to bring people to this region to stay and to work and to live and to raise families. And we've been going backwards. So hopefully that if we can somehow get our arms around this issue of air pollution, we're not going to close down the Clairton Coke Works, obviously. It's not going to be Shenango, but to make it a better performing company that hasn't neglected maintenance for decades after decades and does the right thing, putting back into our community the kind of investments that should be made. Matt Medallic made that point very clearly. I think we have a future. So anything else to add, Mark?
Howard, I would like to put this in front of you as well. So in the fall of 2023, I, along with Council Member Macy and Council Member Pritzio, met with the county manager. And during that meeting, we were talking, we began the process of discussing a climate action plan on the part of the county. The county is still working on this, but the previous administration agreed to it. They agreed to create a director role for the person who would be responsible for the climate action plan, who would report to the county executive. And I call this out because in addition to my being there, Council Member Pritzio and Council Member Macy, who was with us this evening, was a part of this. So I think that in the spirit of that commitment to a climate action plan for the county, acting in the affirmative on what is before us right now would be a little more than just talk. It would be, kind of walking the talk and saying, yes, our commitment to addressing the climate change challenges that we face is real. And in supporting this particular measure, it is our attempt to live that out and act in a way that's consistent with that commitment that as a county, the county leadership has made. It would seem that that would be really significant. This would be really significant.
Thank you, Paul.
There was just there were still many more questions in the chat. I know that we're short on time though at this point. Some of them are really extraordinary questions. There was one though that I think was asked a little while ago that got lots of attention on the chat, which is to Councilperson Bob Macy. Now that you know that the taxes won't go up, would you change your vote and support air quality measures discussed?
I'm probably going to give you a political answer. I said I would sit down with my colleagues on the committee and certainly come to some kind of resolution. I can't give you an exact answer at this point, but I promise that I will be working with my colleagues. And as Paul said, and Michelle, we think we can get this done.
Thank you very much. Appreciate your response. I apologize to everybody else who put in an excellent question or comment in the chat. Please go ahead and read those. Howard, though, at this point, would you like to wrap things up or continue a little longer?
Well, if there's anything of importance that you see there, I think you can maybe raise one more, and then we'll wrap it up.
Okay. Let's see. Gosh, to pick one more. I think we've addressed a lot of different ones. I think that there's one towards the end. Matthew Namath asked, I'd like to hear each council member acknowledge whether they think this limited permit fee process is operating as a pay-to-pollute system. So I'd like to hear whether each council member acknowledge whether they think this limited permit fee process is operating as a pay-to-pollute system.
Just to expand my answer a little bit, I think both Paul and Michelle kind of touched on this earlier, but this particular conversation that we're having right now on permit fees, I think is entirely separate from the pay-to-pollute conversation, right? I personally think that there's a strong argument that that's currently what's happening generally, but these permit fee increases are just to pay the workers that we need for our county health department so they can generate the Title V permits so that these companies can continue to operate, right? Because over the years, we have been, as taxpayers, subsidizing these permits being created. We have paid for them through taxpayer dollars. This would just shift the burden to actually pay for the operating permits onto the companies that are utilizing them. So I think it's a bit of a separate conversation.
Thanks, Dan.
Are the others in consensus on that? Any other comments?
Yeah, no, I agree with Dan. I mean, we're taking a look at trying to address a backlog, a permitting backlog that was, highlighted by the EPA. And I think that, this is really all about imposing these higher fees because we haven't had a fee increase since 2021. And if you've, kind of looked around, the cost of everything has gone up, and yet there's still this inclination to put government on a diet where the cost of everything continues to increase. So I think that Dan really captured it. That is what the focus of this new schedule is all about.
Yes, and I agree with Dan. Thank you, Dan.
Super. Thanks to everybody for clarifying. There's one other note from Dr. Thurston in the chat here. Please be aware that Dr. Yu's manuscript on the respiratory health benefits of the Shenango closure will be released later this month. And with that, Howard, why don't you go ahead and wrap us up?
Yeah, listen, I thank everybody, particularly the Representatives Council who saw fit to attend tonight. Bob Macy, I know you've been non-committal on this issue, and you've been forthright in your presentation, your comments tonight, and we hope that the kinds of collaboration that you plan to do with other members of the council will lead to a solution. We're doing what we can do. We bring people together to try to make a difference. We love Pittsburgh, and we think it has tremendous benefits that go beyond so many other cities. We can be better, and this is an opportunity, hopefully, where we can prove that. So thank you all for being here tonight. Thank you to Dr. Gentile and Dr. Yu for presenting, and really appreciate everybody's participation. Have a good evening.
Thank you, Howard.
Thank you.
Thanks, everybody.
Thanks, everybody, for joining. Until next time, take care.
Thank you, Mark.
Really, you're welcome. Yeah, really appreciate the lively conversations, great questions, great answers, very helpful, candid conversation. I'm grateful to everybody involved. Thank you.